morning of June 27th, 2017. Round 3 chemotherapy starts in a couple hours. Somebody had mentioned that, hey, you should document some of the stuff that you're going through. So when years from now, you can make it through anything if you got through this. So I figured, hey, why not? And plus, people have asked, what was worse? Is radiation worse? Is chemotherapy worse? Was the surgery worse? Well, to be honest, all kind of sucks, but you get through it, and you just take it day by day. So that's what I've been trying to do. Um, Last night I yesterday I had Taco Bell. I had some Little Caesars pizza. I think I polished it off with some ice cream as well. So just trying to increase the caloric intake as much as possible because I know the next few days, probably 5 or 6 days, will be pretty rough and won't feel like eating much. So just trying to get my energy in now. So yeah, so that's what I'm gonna do. I'm gonna try and document some of these uh, side effects and what I'm going through, just to give you an idea of what it's like. So round 3, stay tuned. Be back in a bit. Okay, round 3 here at treatment now. Um, Already getting a few side effects. The taste in the mouth, the hands are not working. You can feel some stuff. So, and I definitely cannot drink anything cold, unfortunately. So that's like the worst part of all, um, because once you drink warm water, it just feels very, very. You get nauseous and things like that. I don't drink coffee or anything. So, um, as of right now, that's kind of the worst part. But you can see I got my port going on there. I got my drips going on. So I'm about halfway through right now, and I have about another probably 2 hours to go. So that's the deal. I'll give you an update when I get home and how I'm feeling and all that other stuff. So talk to you soon. All right, finished up. I am done now. I am back in the car. Got there at 9:30, done at 2:30. So we're looking about 5 or so hours. So the crazy thing is, so I still got my port here. They send me home with this thing. I call it a grenade. It's like another pump. It continues to give the chemotherapy over 40 hours, and then I go back and I get that disconnected from the port and so forth. But in terms of side effects that are happening right now, the cold sensitivity is pretty instantaneous, and where it happens most is when you're drinking anything that's cold. So everything's got to be room temperature again, which is horrible. That's one of the worst things, just because I like everything cold. And my fingers are numbing a little bit. That's some neuropathy that's happening, and you also have cold sensitivity there as well. But nothing else yet. No nausea, no fatigue, no anything. So I'll check back in later. See y'all. All right, good morning. It is the day after chemotherapy treatment, round 3. Had a pretty good night last night. I ended up going to my son's swim meet, and 3 weeks ago I wouldn't be able to last 10 minutes, so I lasted 2 hours at the swim meet. So slowly gaining energy back, getting well from the radiation and the surgery. Hopefully that is outweighing the side effects of chemo, and I think it is. So making good progress. As far as side effects go, with the chemotherapy for round 3, we talked about the neuropathy in the hands and the feet. Feet are coming into play now, so they're going to sleep a lot easier. Still the cold sensitivity.
not much fatigue yet, which is good. One thing that I am a little worried about is the last two times, one of the side effects from this anti-nausea medication that they give to you, it makes you hiccup. And I had hiccups for 7 hours straight one day. It was horrible. But what they say is, hey, if you're hiccuping, then that means you're not getting nauseous. So, it's kind of the lesser of two evils. After 7 hours, I almost wanted to throw up. But um, anyway, what they do is they give you, believe it or not, there's an anti-hiccup medication that you can take. And once I took that, I got better. But I had hiccups this morning. Ate something that kind of went away. So I'm hoping they don't come back, because the anti-hiccup medication has, one of the side effects of that is um, fatigue and dizziness, and so I'm not real sure whether or not it's the chemotherapy that's causing the fatigue, or it's the actual anti-hiccup medication. But um, feeling pretty good right now. I will check back in later on the day. I'm looking myself. I'm looking a little rough, so I'm gonna shave up, and I'm looking like a sick man here. So I don't want to look sick. Um, I'll trim up and look a little better for you guys next time. Take care. Talk to you soon. All right. Wait for it. Wait for it. We're still waiting. There you go. Hiccups have set in. I've had them for a couple hours now. Super annoying. As you can see, I haven't shaved, shower, or anything as of yet. But hopefully, I take this medicine now and it will, kick in and get rid of these things because they're super, super annoying. I'll check back in later. All right, we are back at Virginia Cancer Institute today. I got an appointment at 1:30 to get my this grenade-looking thing that's given me chemo for the past 48 hours was completely full. Now it's completely empty, and with that, they're also going to give me some fluids. I'll get an IV just because I tend to get dehydrated because I guess the chemo takes it out of you, as well as me not drinking enough water or liquids to keep myself hydrated. So I should feel pretty darn good after I get some fluids in me via IV. The heads up on the hiccups, I've had them sporadically, I guess, over the last couple of days. The 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 medication that they give me is working. So hopefully that'll be enough. That'll be done with the hiccups, and then on day three, which is tomorrow, day 3, 4, 5, fatigue normally sets in. So I'll keep you posted on that. People ask, well, what does the fatigue feel like? What does it feel like? Just picture kind of like your worst hangover that you had, and it's like that for about 3 or 4 days. So we'll get through it and we'll make it happen. And then by day 6, I should be feeling pretty darn good. So that's the latest. Getting this all stuff off of me today, so I'll have one less appendage on me. So that's good. All right, talk to you soon. Hey there, it is Friday morning, June 30th. Just giving you an update. Had chemo on Tuesday, June 27th, so we're looking at 3 days after chemo. Last night wasn't a great night. Didn't get a ton of sleep. I think fatigue is definitely setting in, but I think the reason I didn't get a lot of sleep is one of the side effects is um, along with the neuropathy in the hands and your hands and feet falling asleep and stuff. There's your hands, the skin on your hands begins to crack a little bit. You can't see it from the picture or anything, but you can see that the hands are really really red right now, and it's painful more than anything. What happens is some people start to blister in the hands, blister in the feet, and the skin begins to peel off. And I haven't had that happen to me as of yet, but gosh, it kind of feels like it's getting ready to start here. So we'll see. What they say is they put lotion on your hands, put lotion on your feet, and then wrap them in like socks and sleeves. That way you can you keep having moisture in your hands, and you may not receive that side effect. But I'll try it and see. Today not a whole ton of energy, unfortunately. Could be a Netflix kind of day for me. Just trying to get through the next couple days. I think once I get through Friday, Saturday, I think Sunday I'll start to feel a little bit better. But other than that, the nausea is not too bad. But I think day 3, 4 is when the fatigue kind of starts to set in, and setting in now. So I'll give you guys an update a little later. Happy Friday, TGIF. And it's close to July 4th weekend, so you guys enjoy.
Okay, July 1st, it is Saturday. Just giving you a heads up. I slept really well last night. Just hard. I went to bed at like 9:30. I don't think I woke up until about 9 a.m. this morning. So got some much needed sleep. Fatigue obviously is definitely set in. Fatigue today as well. I'm a little tired, but my hands are feeling better. The cold sensation's going away just a tad. I had one ice cube and a drink today, so little victories. That's good. The hiccups are gone. So the way that this is the third time that I've been through this now. I have 4 more months to go, so I have nine more rounds to go. But out of a 30-day month, probably 8 to 10 of those days, I'm not going to feel real good. But the other 20 days, I'm not going to feel 100%, but I'll feel a heck of a lot better than I do right now. So, I can get through this. Again, it's 4 more months. October 31st, 10/31 is my last day of chemo. I cannot wait. So I appreciate you guys listening to me and really figuring out exactly what some of the side effects are. I appreciate some of you guys asking me to do this. Kind of therapeutic for me as well. Hopefully by tomorrow I'm going to feel much better. That it'll be like day 5.5, and I'll be getting back to normal and feel good for about the next week. Then I'm back at it. So I got this. We got this. Looking forward to Halloween. Looking forward to October 31st when it's all said and done. Thank you, guys.